So you've been diagnosed with a thyroid disorder and put on medication, but is that medication actually fixing your problem? Hi, I'm Dr. Tuna's son, and in this short video, I'm going to tell you why your medication might not be enough to fix your thyroid problem. When it comes to thyroid testing, the only lab that your doctor has to do is to simply test a hormone called TSH to diagnose whether or not you have a thyroid condition. If it's too high, then you have hypothyroidism. And if your TSH is too low, then you are diagnosed with hyperthyroidism. Depending on your diagnosis, your doctor will recommend a method of treatment that will almost always include the use of medication. If you're a hypothyroid, it will most likely be Synthroid or a generic alternative such as levothyroxine. If you're a hyperthyroid, you are typically advised to remove or radiate your thyroid first, and then you're put on medication like Synthroid or Levo. But what are these medications actually doing, and is it providing you the health that you're truly looking for? The most common form of medication, such as Synthroid or Levo, is simply a synthetic form of T4, which is a hormone that your body actually makes. And as you take this medication, your body will begin to decrease your TSH levels back to normal. So when you're retested by your doctor, they show you how your levels are now normal and that your condition is now under control. But why do so many people continue to suffer with symptoms despite their normal looking levels? In my clinical experience, I found that this is because despite the medication and the normal TSH levels, the most active form of thyroid hormone is not being metabolized in your body, therefore leaving you suffering with symptoms. See, your thyroid makes two main hormones, T4 and T3, but it's the T3 that is the more active form and what your body really wants. So when you are simply taking the T4 medication, your body must properly change that T4 into the active form of T3. This is where so many individuals struggle because there are tons of things that affect that change. 60% of that change happens in your liver, 20% in your gut, and another 20% is changed into another form called reverse T3. And if you don't have enough of the important nutrients such as selenium or zinc, you will continue to struggle with this change. And what about stress and your adrenal glands? Did you know that when you have a lot of stress, a hormone called cortisol is released, and when it gets too high, can also stop the important change of that T4 to T3 as well? The simple truth is that your medication isn't addressing any of these other factors and is why you will continue to suffer despite your normal lab values. To truly achieve the thyroid health that you desire, you must be willing to dig deeper and have a comprehensive approach to your health. There is a time and place for medication, but should only be used when all the other factors have been addressed as well. To find out more about how to have your thyroid properly tested, and if you live in the Charlotte area, then I want to invite you to come to one of our upcoming free thyroid seminars. Simply go to www.freedinnertalk.com to learn more and to register today.